I would like to start today by telling you about a patient that I see often in clinical practice. This is someone who was diagnosed with GERD many years ago, and they were started on a proton pump inhibitor. And at first, it helped. Their symptoms improved. But over time, they became worried about the long-term risks of these medications, so they stopped it. But their symptoms came right back, in fact, worse than before. So they went right back on the medication, feeling stuck, frustrated, and a little worried. They went back to their PCP, and they had the appropriate workup. They even had an endoscopy, which was normal. And now they're sitting across from me asking, if all my testing is normal and I still feel like this, am I dependent on these medications for life, or is there anything else I can do? If that sounds like you, then you've come to the right place. Because when conventional testing is normal, but you still have symptoms, it doesn't mean that nothing is wrong. It just means that we need to look differently, ask different questions, and support the body from a more holistic approach. So today, I'm gonna walk you through how we think of GERD from a functional medicine perspective, and how it may not be a problem with excess acid alone, but as a reflection of many upstream imbalances that need support. As always, this is for educational purposes only. Always consult with your personal healthcare provider before making any changes to your treatment plan. So one of the most important shifts in functional medicine is that we think of GERD as a problem of many things besides just acid. GERD is typically an issue with the coordination, the timing, protection, and resiliency of the digestive system. When those systems are out of balance, reflux symptoms typically show up, even when the endoscopy looks normal. So in functional medicine, we use a framework called the 5R approach to help restore digestive health. These stand for remove, replace, reinoculate, repair, and rebalance. This gives us a framework to think about what is driving the symptoms upstream instead of just suppressing them. So first, remove. This means identifying and removing things that are upstream that may be irritating or disturbing GI function. These include any of those foods that reduce that lower esophageal sphincter tone, that valve at the bottom of the esophagus that can sometimes be inadvertently relaxed, allowing acid and other contents to reflux from the stomach, reducing large or late night meals, alcohol, unrecognized food sensitivities, certain medications, as well as chronic stress. Chronic stress sends signals to the digestive tract that keeps it in a fight or flight state. Next, replace. Many people with GERD don't actually have a problem with too much acid. They have an issue with improper digestion or motility. This is where we think about supporting normal digestive signaling and motility. In functional medicine, this might include things like digestive bitters, ginger, magnesium for motility support, and other digestive supporting herbs or botanicals. The goal here isn't to force digestion, but it's to support underlying motility, coordination, and flow of the digestive tract. Third, reinoculate. The gut microbiome actually plays a much larger role in reflux than most people realize. When the gut microbiome is disrupted, we can see issues with gas, bloating, disrupted motility, and heightened visceral sensitivity. So reinoculation might include things besides just probiotics, such as prebiotics, fermented foods, and targeted microbiome support that's individualized to that person. This step is especially important for those people who have overlapping syndromes of GERD with irritable bowel syndrome or IBS, SIBO, or even food sensitivities. Fourth, repair. So chronic reflux often goes hand in hand with impaired mucosal integrity. So repair here focuses on supporting the lining of the esophagus, the stomach, and the intestine. And we may use nutrients or botanicals here, such as zinc carnosine, DGL, or aloe-based compounds. These aren't acid-blocking agents. These are tissue support, designed to help the lining become more resilient. And finally, rebalance. This is the step that's often overlooked. Did you know that the digestive tract has its own nervous system? It's called the enteric nervous system, and it's deeply influenced by chronic stress, circadian rhythm, and emotional load. Reflux is often much worse when a person is stuck in that fight or flight state. So rebalancing here includes those stress-reducing activities, mindfulness, meditation, breath work, improving sleep quality, and circadian rhythm. Melatonin is actually a great example here. Melatonin plays a critical role in that lower esophageal sphincter tone. So if someone's circadian rhythm is disrupted and they have low melatonin production, that may be a window of opportunity to support both circadian rhythm, quality of sleep, and improve their GERD symptoms. One of the most important things I want to emphasize is that healing and restoration are a process, and it takes time. These systems did not become dysregulated overnight, and they won't restore overnight either. As old systems unwind, as the nervous system recalibrates, and the GI tract begins to heal, symptoms often improve gradually not instantly. And progress is rarely linear. You may have temporary ups and downs or minor setbacks in the healing journey, and that's normal. That's expected. And that's one of the reasons why working with a knowledgeable practitioner can be really helpful in this process. Having guidance helps assure that the right layers are addressed, that progress is interpreted correctly, and the process feels supportive rather than overwhelming. Healing doesn't have to be rushed, and it doesn't have to happen alone. So when we put all of this together, we are really addressing maldigestion, malabsorption, motility issues, dysbiosis, intestinal permeability, GI inflammation, and gut-brain axis dysregulation. This is why the functional medicine approach can be so helpful for patients who feel like they've tried everything. If you've been on a PPI for years and you feel stuck, it doesn't mean that you failed. It doesn't mean that your body is broken. It usually means that the plan never evolved and that your body is asking for more support. If this video resonates with you, I'd love to hear from you in the comments. Does this story sound familiar? What part of GERD has been the most frustrating for you? And if this series has been helpful, please consider liking and subscribing. It really helps this new channel grow and reach new people who are looking for a thoughtful and functional medicine approach to healing. I'm Dr. Kate, and thanks for being here.